Hi, in the UK, an estimated 1.1 million people have reported symptoms which have persisted more than 4 weeks after their first suspected infection of COVID-19. That's 1 in 5 people who have tested positive for COVID-19 have suffered from now what is called long COVID. The NICE guideline states that long COVID is defined by symptoms lingering more than 12 weeks after diagnosis. Currently, it's not clear why some people experience long COVID and others don't. Therefore, a major £2.2 million research project has been announced, which will look to improve treatment and understanding of long COVID. That will prove vital as more people are affected. So what are the long COVID symptoms? If you have had coronavirus and you have found that you have continued to suffer from symptoms that last for weeks or months, which may include breathlessness, extreme tiredness, problems with memory and concentration, a cough that's been ongoing since you've had COVID-19, difficulty sleeping, dizziness, pins and needles, joint pain, chest pain or tightness, heart palpitations, which obviously need urgent investigation, so it's important to seek medical help as soon as possible, depression, anxiety, tinnitus, earache, feeling sick, diarrhea, stomach aches, loss of appetite, a high temperature, cough, colds, headaches, sore throat, changes to your sense of smell or taste, and rashes. Those who have required intensive care whilst in hospital when they had COVID-19, their symptoms of long COVID include cognitive impairment, decline in mental health, chronic pain, fatigue, and shortness of breath, and in some severe cases, organ failure, such as that of the heart and the lungs. If you are worried about any of the above symptoms and have been suffering for 4 weeks or more after having COVID-19, then get in touch with a GP for support and management of your symptoms, especially if your symptoms are having an impact on your life. One of the most common symptoms of long COVID is feeling low in energy or fatigue, as long COVID can make you feel like sleeping more, feel unsteady on your feet, not being able to stand for very long, not being able to concentrate very well, and you may notice that your memory isn't as good as it usually is. So what do you do about low energy or fatigue? You must recognize that fatigue is real and be kind to yourself. Explain to your family, explain to your friends, explain to your colleagues at work the impact the fatigue is having on your life. Because fatigue is invisible, sometimes it's not properly understood. Until it is experienced, it can be hard to understand the impact of fatigue and how debilitating it can be. One of the ways of managing fatigue is to get a good night's sleep, as fatigue feels much worse if your sleep pattern is also disrupted. Why not try relaxation techniques? These can help with fatigue as they promote a good night's sleep and a good sleep pattern and can help reduce stress. Consider trying techniques such as mindful meditation, aromatherapy, yoga, tai chi, or other activities you find relaxing, such as reading a book, having a long shower or bath. Plan, prioritize, and delegate. Plan each day in advance so that you can do what you need and consider what can be delegated to other people. Build a regular routine and try to avoid being very active on the good days and then feel exhausted the following day. An activity diary can help with this. Prioritize. You can also decide which activities are the most important to you, and if they're not, what can be done later or delegated to others. This will save you energy and allow you to do tasks when you're feeling more active. Delegate. Think about areas where you can save energy, for example, online shopping rather than the trip to the supermarket, or cooking in the weekend for the week ahead if you are planning to be busy. Make sure you're also doing some things that you find enjoyable, as these can be energizing too. Keep an activity diary for 1 to 2 weeks and record what you've done during the day and how you felt after each activity. Also note if you had a good day. Activities can be physical, social, cognitive, or emotional. Diaries can help you spot unhelpful activity patterns, such as irregular sleep patterns, or are you doing too much on good day type behavior. Keep active. Energy levels are always helped by staying active. Being unfit makes you more tired. Once the amount of activity you are doing is stable, try to increase the amount you do slowly and gently. Eat well. When you are low in energy, it's very easy to miss meals and snack on foods which are high in sugar and fat. These foods are often poor in nutritional quality and can increase your anxiety and feeling of helplessness. So try to eat regular meals by choosing from all the main food groups, and drinking around 6 to 8 cups of fluids a day will definitely help with replenishing your energy stores and aid you towards the road to recovery. Remember, this information is all free, so don't forget to subscribe, like, share, or follow Conscious Bites Dietitian.